I'm here with Dr. Cristina McDaniel at ExerciseCoreMobilization or ECM Physical Therapy. We're here today speaking about the Schroth Method. So, Dr. McDaniel, can you briefly describe what the Schroth Method is?
Schroth Method is a treatment developed by Katharina Schroth in Germany years ago for her daughter. Her daughter suffered from advanced scoliosis, is a curvature of the spine, and without proper intervention, the spine just keeps on twisting, and then they develops this kyphosis and also pinched nerves and the narrowing of the spine.
And what types of conditions does it work or does it help with?
Oh, a lot, not just scoliosis. So over time, it evolves. Specialists like me who specialize actually in 3 levels of Schroth, which is not a lot of doctor or PT are certified for 3 levels. You have to learn 3 level 1, 2, and 3. And when you learn that, you could actually advance Schroth method or the Schroth treatment to use it with all types of back issues, not just even back issues, but aligning of the hips, post-surgical, which has something to do with, let's say, fusion of the spine, pinched nerves, and other back issues, and sometimes even shoulders, because the shoulders, is attached to our spine. So Schroth method, it works well with that. And any other, issues, even the ribs. If some people have rib issues and it's connected with the spine problem and lordosis, it benefits a lot.
So, what can the patient expect when doing the Schroth Method?
Basically, they need to have commitment. It starts with the way we because I customize the method, the treatment per patient. Each patient should not have a by the book treatment. That's one special thing about our rehab, is that we customize our treatment. So if I see a patient that has a thoracolumbar, there is a different exercise. We also factor the age, the strength of the patient, how much commitment the patient is going to have. So we require sometimes 16 to 22 sessions, and the patient is given exercises to do at home as well. And pain management is being treated, the pain is being treated, pinched nerves, posture, and also practice of trying to breathe well, due to the fact that most of the time when we're stressed, our back tenses. And so with breathing, with Schroth method, we practice a lot with breathing.
And does the Schroth Method provide short-term or long-term solutions to the conditions that the patient comes in with?
Again, it depends on the commitment of the patient. So if the patient is really committed, it actually avoid surgery. People, that's committed with the Schroth method, and then they practice. Then they come back, let's say after 22 sessions, so they're discharged. They do their exercises at home. They come back for after about 6 months, and then they do another like 4 sessions just for refresher or new exercises, due to the fact that if you keep having the same exercises at home, you end up developing the muscle memory, and that's when this doesn't work anymore, because your body is so used of such exercises. So you come back, and yeah, it can be long term, but again, it's really also to the commitment with the patient.
Okay. And you had mentioned that there's different levels of Schroth practitioners. Can you describe that?
So Schroth method is actually taught here in the United States, as far as I know, when I went to school, and it's part of our curriculum. It's the study of spine, the study of the problem in the spine, what occurs is scoliosis, lordosis, and stuff like that. But we were taught the basic, Now, if you want to specialize in Schroth method, you can specialize with 1 level, 2 level, or 3 levels. I completed 3 levels. So with level 1, you basically learn just a certain area. Level 2, you learn also another certain area. Level 3, you learn all the areas, and on top of it, you basically advance and open the door where you could customize the treatment per patient and factor again, as I said before, the age, the strength, and if the patient also have other issues. I had patients that come here with knee issues, so they can't really do some exercises for level 2. So you have to customize. You have to be quick and fast in thinking on how to change the exercises that could fit the patient's need.
Okay. And with the Schroth method, do you work or correspond with orthopedic doctors?
Oh, absolutely. So after certain treatment, we see either progress or just a plateau. So on the 8 sessions, that's when we check how does the patient react to the Schroth method. Now, if we had eliminated the pain, we had eliminated the number 1 issue, and there's no other issues that occur, then we call that a success. Now, from 9th session, so on, then we advance into strengthening and then continue with the lengthening of the spine, derotating the spine. But if there's some issues or it plateaued, then we recommend the patient to see an orthopedic that specialize in spine. And so they get checked, they get another set of X-ray or MRI, and then see if they could benefits for continuing Schroth method, or do they need either another form of pain management and continue the Schroth method. But again, we have to work with an orthopedics because 1, we actually need the X-ray and an MRI before we start the treatment.
Okay, thank you. And if anybody has further questions or wants to get in touch with you, what's the best way they can reach you?
They could call a clinic at 646-918-7138, or they could actually email us at ecm353pt@gmail.com, or direct email me at shrothdoc808@gmail.com.
Okay, and do you have a website they can check you out on?
So you could actually visit our website at ecmpt.org.
Okay, well, thank you for answering the questions on Schroth therapy. And if anyone has any questions, please feel free to contact Dr. McDaniel. Thank you.